Hello everyone, I'm Dr. Sahana Shetty from Kasturba Medical College, Manipal, and I'm here on behalf of the Karnataka Endocrine Society to provide a message on the eve of the World's Thyroid Day. Thyroid diseases are very common worldwide, and what is most stunning is that 60% of people with thyroid disease are not aware of their disease. And also, the fairer sex, that's women, are more prone for thyroid diseases, who are 6 to 8 times more likely to have thyroid disorders than men. In order to increase the awareness about thyroid health and thyroid diseases and to take public health measures, May 25th is observed as World Thyroid Day across the globe. From the Karnataka Endocrine Society, we are having this message to create awareness about thyroid health and thyroid disorders. Now, let us first understand what is thyroid gland. Now, thyroid is an endocrine gland which is present in the center of the neck. It's a butterfly-shaped structure which produces thyroid hormones and releases into the blood, which controls several important physiological functions in the body. Several critical functions like the heart rate and our nervous systems, our reproductive systems, menstrual cycles, pregnancy, etc., are under the influence of thyroid hormones, and the hormones regulate these functions. So any disorders or imbalance in these hormones could lead to alterations in the several physiological functions in the body. When we talk about thyroid diseases, we can broadly have three types of diseases. To begin with, first, we could have abnormalities in the thyroid hormones. The thyroid gland produces mainly two hormones, that is the thyroxine, that is T4, and thyroidothyronin, that is T3. It also produces calcitonin, which is concerned with calcium homeostasis. Now, the thyroxine and the T3 are hormones which regulate critical functions in the body and also the metabolism. Now, there are conditions where there would be excess thyroid hormone production, which is called as hyperthyroidism. On the contrary, there could be conditions where the thyroid is under functioning or is producing less thyroid hormone, or one is deficient in thyroid hormones, and this condition is called hypothyroidism. Now, in patients with hyperthyroidism, where there's excess thyroid hormones, there could be increased metabolism, hence one presents with weight loss, shakiness, palpitations, anxiety, nervousness, etc. On the contrary, those with hypothyroidism may present with weight gain, low mood, lethargy, forgetfulness, hair loss, menstrual disturbances, etc. Secondly, in thyroid, one could have inflammation in the gland or infections. It's called as thyroiditis, and here these patients may present with the pain in the neck or swelling and could be associated with either hyperthyroidism or hypothyroidism, like I earlier mentioned. And third category includes patients who present with swelling in the neck, which could be because of the either the swelling of the whole thyroid gland, which is called as a goiter, or it could be an abnormal growth, which is like a thyroid nodule, which could be single or multiple, as in multinodular goiter. Now, this could be just a swelling in the neck, or some of these nodules could rarely be cancerous and could have problems. Now, what is important to understand is that although there are several diseases which can affect the thyroid gland, most of these diseases, if diagnosed and treated appropriately, either can be completely cured or can be controlled. For example, for patients who have hypothyroidism, where there is deficiency of thyroid hormones, one could just replace this deficient hormone, that is thyroxine, which is the deficient hormone. Now, this can be provided in a tablet form for treatment of hypothyroidism, thus making these patients completely euthyroid on medications. Now, even for hyperthyroidism, you have either medications or iodine therapy, which could cure the disease. And then when it comes to even thyroid cancer, now here with early diagnosis, you could either provide cure to the disease, or in patients with advanced diseases, one with appropriate treatment, you could control the disease. It's very important to be aware of the signs and symptoms of the thyroid disorders, and also to consult the right specialist in the disorders and take appropriate treatment. Now, the last thing I would like to say is the message of this year's World Thyroid Day 2022. So the message is, it's not you, it's your thyroid. Now, what does that mean? Now, although the thyroid is located in the neck, the symptoms of hormonal disorders or the symptoms of imbalance in the thyroid hormones could be vague. For example, like in hypothyroidism, one could have weight gain, one could have reduced memory or forgetfulness, poor concentration, etc., which is not a deficiency of the person per se, but it's rather the deficiency of the hormone which is causing these symptoms. And it's important to understand that it's not you, but it's a thyroid problem which is causing these symptoms. So understanding this will help us to receive appropriate treatment. So with this, I would like to end my time. Thank you.